name is Cliff Robinson. I'm a radiation oncologist at Washington University in St. Louis. For someone who's come in, like yourself, to get a course of radiation for their lung cancer, it's really, really common for people to want to know, when are you going to check? How are you going to know when it's working? How long am I going to have to keep checking on this? Now, for most patients, it's pretty similar, although there can be some differences depending on our goals. As many patients want to know is, when will you check right after treatment? And the answer is typically no earlier than 6 weeks. We want to wait enough time to make sure that we're going in the right direction. And this tumor, which often takes time to shrink, is having a positive response to treatment. The longer you wait, the more likely you are to see that. We'll often say things like, the radiation keeps working after your treatment is completed. Now, it's not that the radiation is still inside you, but we see the effects of the radiation for many, many months, if not longer, after the treatment, as that tumor dies and as your body is able to go in and clean up those dead cells and then ultimately see those shrink on a CT scan. So that takes longer than people realize. Typically 6 weeks is the earliest. Often it's about 3 months after treatment before we might have the first real scans. We try and do CT scans on a regular basis, typically every 3 to 6 months for the first 1 to 2 years. After 1 to 2 years, if things are looking good, due to the nature of lung cancer, where it has its tendency to come back most frequently within that first 2 years, as we get past 2 years, it becomes less important to image as frequently. And so we'll start going to 6 to 12 months at that point. Typically, you're not going to get away with going any longer than a year in between scans. And that's in part because even after you have had a good response to treatment, and perhaps we start to tell you that we think that the tumor is sterilized and gone and dead, and you may be cured of the cancer, people who have a history of lung cancer have a tendency to develop additional cancers. And those additional cancers often are going to be in the lung itself. And so just like patients who are heavy smokers, who are between the most common range in which you might develop a cancer, we start to screen those patients with yearly CT scans. So too is someone like yourself who has undergone treatment and survived their lung cancer. You would also benefit from those CT scans. And what we have found is that on average, somewhere in the order of 0.5% to 1.5% per year, patients will develop additional tumors. And if they're caught at the earliest stages, they are much easier to deal with. And often they may be then managed with less aggressive treatments and have a higher tendency to be cured. So at the end of your treatment, you can expect that there's going to be a series of visits, and we're not quite done with you yet. And in fact, it often ends up becoming a long-standing surveillance relationship where you come in and see your doctors on a multi-month basis. And ultimately, there really is no true graduation, although sometimes you can go at least a year in between those visits.